Okay. Is it recording, everyone? I think so. Awesome. So thanks everyone for coming today. This is kind of our first inaugural meeting as a research group. And as I posted in the chat, we're going to go over a couple different things that are going to be really important moving forward to this research effort. So for many of you, this is the first time that you're getting to meet with me, talk with me. And, my name's Ajay. I've been the one who's often communicating with you throughout the summer via email. And, I really just wanted to, yeah, I think everyone's done a really good job with keeping involved in this study. It's been a little challenging with COVID. Originally we were intending to start this in March, having, got approval for everything. Many of you joined the group in the spring, some of you in the, previous fall. But, now we are getting in a position where we're ready to resume research for this study and really the clinical patient enrollment and everything in the next week or two. So we're really excited about that. And, I also just wanted to recognize some of the study leaders here. So, and you'll hear from them a little later when they're going to talk about the research assistant drive. But it wouldn't be possible without, one is Susanna. She worked with me hand in hand with writing the protocol and really developing the study in its early stages. Similarly, we have Riken, who's, again, he's the reason why we're connected with Dr. Siegel, who's the chief of nephrology and has been a really incredible mentor guiding our project. And of course, we have Kevin, which you all know, and he's going to be essentially the study coordinator. He's your ground guy. You can talk to him about anything happening logistically as we move forward towards the patient enrollment period. And to begin, I just wanted to go back to really what the purpose and a little bit about the background of the study. So really what's exciting about this study is that we're looking at the intersection of two things that I think we all are interested in. It's technology and medicine. And in this study, we're able to combine those two and really have an opportunity to answer some important questions that exist in how we can incorporate technology into healthcare and really do one thing, which is utilize low-cost, scalable technologies to impact health in a really broad way and meaningful way. And that really is the inspiration for the MobileECG study. In this study, we're using a device called the CardioMobile. And what the CardioMobile does is it connects with the iPhone wirelessly, and it's able to do a 30-second ECG strip. And I know many of you have done a great deal of research already on this type of topic, doing literature reviews over summer. And I think that was really constructive. So you have a good appreciation of what this technology has to offer. And you can start thinking about the ways in which we can really advance this moving forward. What we notice is that there's a gap in the literature in how this technology was used in populations that have particular risk of heart disease and atrial fibrillation. So rhythm problems affect a lot of people. In fact, AFib is anticipated to affect around 12 million people by the end of the decade. And that's just in the United States. So with this study, we're looking at kidney disease patients. So the importance of that is that these kidney disease patients are at higher risk than just about anyone else of getting these kind of heart conditions. And often at nephrology clinics, you're never going to get an ECG. It's really, if you go into an emergency room, if you're seeing a cardiologist, maybe, you'll get this type of test. So what we have the ability to do is within 30 seconds, we get a preliminary exam where we're just really looking at rhythm. And, originally the study, we're looking at really a broad range of use cases for mobile ECGs. In fact, one of them was about hypertrophic cardiomyopathy, HCM. What that is sometimes athletes, they get this unfortunate sudden cardiac death. And that happens because of a genetic problem, which is hypertrophic cardiomyopathy. And you can detect that in some ways through ECGs, but what we were more interested in is how can we, apply this technology to affect the broadest range of people? And that led us to investigating atrial fibrillation and rhythm problems. And what the KardioMobile is really good at is detecting just those things, AFib, as well as bradycardia and tachycardia. Brady is a little slower heartbeat, and tachy is a little faster heartbeat, above 100 beats per minute. So all that type of thinking really led up to why we're here today and why we're assessing patients in the nephrology clinic, because we think these people can be best served by this technology. And what we hope is that if a patient doesn't have a reported AFib in their medical history, and we're able to detect that in the patient, we could actually have a really beneficial outcome for that patient, because the doctors will be able to know about the issue. They'll confirm it through another ECG exam, and then they could get treatment, and this could potentially really help the person, depending on how bad the AFib affects that individual. And this kind of opens up to this broader discussion about digital health and innovations in medicine. We're growing up in a really interesting time with coronavirus, and you see it accelerate telemedicine tremendously. And as EAC volunteers, you've seen that through how you're operating clinics. What we're working on is just one aspect of that idea, and it's really focused on digital health. But aside from that, there's other lanes such as big data, machine learning, which is really what we're using the data that we're getting from the ECG strips into using KardioMobile's platform. Virtual medicine, genomic editing, all this stuff is going to be very applicable in your lifetimes, depending on, what you want to do in medicine, whether that's being a physician, PA, dentist, technician, anything. They're all involved using this technology. So that kind of gives us a little framework about, what this study is and what we're looking to learn. Now, what I want is in the chat bar, that you guys can pull up, there is an option to press the research assistant drive. So I'd like you all to press that, and then I'll allow Susanna to talk about the first thing, which is the informed consent and survey. And Susanna, maybe you want to share your screen as well as you present about it.
Yeah, so hi everyone, I'm Susanna. Nice to finally speak to all of you. I'm gonna go ahead and share my screen. Actually, AJ, can you it's disabled right now?
Okay, sure. Let me see. I'll make you a co-host. I think that should help.
Okay, perfect. Thank you.
So make you a co-host.
Okay. Can everyone see now?
Yes.
Okay, great. So in our research assistant file in Google Docs, we have, you click Research Assistant Drive, there's the Informed Consent Plus Survey. So you can all click that. And then we have three main documents here. We have the informed consent as well as the study participant survey, which will both be printed out for you, and they will be present in the EAC office. You'll collect those documents and you'll walk them over to the nephrology clinic when we start data collection. And then we also have this little recruitment script, which is really nice because it basically summarizes what you'll be talking to your patients about. And there's really 4 main points. You don't have to memorize this whole thing. That's not necessary. I do recommend you guys read it a couple times just so that you get a gist of what you have to do. But there's 4 parts. It's just introducing yourself and what you're doing, what you're a part of. 2, introducing the study and what it's about. 3, telling the patient what their participation entails, what we're asking of them. And then 4, just asking the patients if they want to participate or not. So as you can see in this example, we just say, hello, my name is blank. I'm a research assistant, part of this innovative research project that's enrolling patients at the nephrology clinic. Our purpose of the study is to determine if a mobile ECG device can provide valuable information in providing care for people with kidney problems. Your participation will only take about 5 minutes, and it includes filling out a 1-page questionnaire as well as recording a 30-second ECG rhythm strip that only uses your fingers. And then you also let them know that the study won't impact their quality of care and that it will grant us access to their medical records for research purposes only. And then at that point, you ask them, are you willing to participate, yes or no? So if they're willing to participate, you move forward to the consent form. Make sure you do the consent form first, because even though we have their verbal consent, we want to make sure that we also have it in writing before we start doing the study questionnaire, which does have personal health information. So make sure you do that first. Now, here is our little introduction. The name of person seeking your consent will be you, so you will write your name here. Place of employment and position, you can just go ahead and write UF Research Assistant, that should be fine. And then our consent form is actually quite long, so I recommend all of you read it in depth after this meeting is over or throughout the next week while you'll be training. You don't have to go super in depth when you're going through it with the patient. I would suggest patient or you run their name before they sign so that they can go through the pages themselves, and you can kind of highlight the most important parts of this, which is what the study is about, what it entails, contact information should they want to contact people in the study, what to expect if they're participating in the study. You can briefly go through this as well with them, and what the risks and benefits are. Now, the risks to this study are really minimal, so they really shouldn't have anything to worry about, but you can briefly go through this with them as well. And then it also goes through how we can benefit from the study, which is just gathering more scientific evidence and data. So as you can see, it's quite long. You can read through it yourselves, and when you do it with them, just make sure you go through the main points of it. In terms of payment for this costs nothing. The patient doesn't have to pay to be a part of this, and they're not being paid to be a part of this either. If at any point the patient wants to stop, they decide to want to stop recording in the middle of the 30-second ECG strip, that's perfectly fine. They have the right to do so. So after you go through this with them, at the bottom, you'll see that there's 2 places to sign. So the patient will be signing and you'll be signing as well. So you'll be signing here, you'll date it, and the patient will sign down here. Make sure that when you date it, you date 2020 and you don't write 20, because you can always add in like 2019 or 2018, which I don't anticipate any of you doing, but just for official purposes, make sure you write the full date, 2020. And then after you do that, you can move on to the survey. Now, the study participant survey sheet is quite self-explanatory. Just make sure you date it, you write the pet participant name, make sure you write really neat, because we'll be transferring all this information into the computer later, and we want to make sure that we understand what was written down. So make sure you write neat when you do these. You'll write the collection code, which Kevin will go through later. It's pretty simple. We're just writing NC for nephrology clinic and then the patient number. So the very first patient that we'll have in the next coming weeks would be patient 1, and then we would write NC 001. If it's patient 25, it would be NC 025. And Kevin will go through that later as well. Now, the participant PRN is their EPIC number. We do have access to their EPIC information, so we can get this from the nurse. However, if for some reason that day you weren't able to get this, that's okay. We can get it later at another point in the study, so it's not the end of the world if you don't get this one. And for this, you would ask the nurse, okay? And then everything else is really self-explanatory. You'll go through their demographics. You'll go through their symptoms and risk factors. You can all read this yourselves. Then you'll ask them their kidney health, if they're on dialysis, just yes or no. And then their heart health and their current care. Just make sure everything is filled out. If the answer is no for any of these, you can just write in none, just so that we know you did go through this with them. And I suggest that you're the ones that are actually writing this down and not the patient, just to make sure that everything gets filled out appropriately, okay? And that's pretty much it. After this, you'll actually start doing the data collection from the cardio mobile ECG, and Kevin is about to go through that. So let me just stop sharing the screen for a moment.
Hey everyone, I'm going to go ahead and share my screen and go over the instructions on how to actually record the patient's mobile ECG. And you guys have access to this to these instructions as well. So I'd recommend having it on your phone or having it on your laptop, just like the first week of data collection. It's pretty straightforward once you get the hang of it. So in the beginning, I just have some general information. The iPhone passcode, in case it ever locks, it's just 147147. The app name is Cardia, and this is the app login information. It should already be logged in unless the phone like runs out of charge, turns off or something. You shouldn't really need to worry about this, but if it ever asks for the app login info, that's over here. Like Susanna said, first you're going to fill out all the paperwork, which is the informed consent form and the survey. And after you do both those, you're going to do the actual data collection. So Susanna mentioned this, the collection code format. It's pretty much going to be the clinic abbreviation, which is the nephrology clinic, and then the patient number. So for the first patient, the collection code will be NC001, patient 25, NC025, patient 115, NC115. And then just make sure if the number's like below 100, that you still have 3 number spaces, just so that when we get to patient 100 or above, we have enough digit values that we can fill in. And then, so when you perform the actual examination, first, I actually have the devices that you're going to have here. So you're going to have a clinic iPhone, which you're going to get from the Equal Access office, and you're going to have the Cardio mobile device. So it's not that like complex or anything. It's just these 2 things, and then the study forms. So I have all of the instructions here with pictures. Since everything is virtual, it's hard to give like an in-person demonstration, but I think it's not complex enough where this should work. This should be self-explanatory if you follow these instructions, look at the pictures. So when you first get into the Equal Access Clinic office for your shift, you're gonna go on the phone, you're gonna open the Dropbox app, and you're gonna go into the MobileECG Study folder. And the reason you're gonna do this is you're just gonna see what the last patient number was, so you know where to continue when you take your first recording. So in this example, I know this picture is kind of small, but the last one saved is NC001. So then you know when you save the next recording, it's going to be NC002. So that's all you need to go to the Dropbox for. And then after that, when you begin data collection, you're going to open the app called Cardia on the iPhone. And then the Dropbox and the Cardia apps are literally right next to each other on like the first page. So it should be easy to find. And then on the home page, you're going to press record your EKG right over here. And then on the bottom, you're going to make sure that you press single lead EKG. It should already be selected, but just in case it isn't, make sure that that's the option that's selected. And then you're going to place the cardio mobile device near the smartphone. You don't have to worry about like connecting it or anything. As long as the Bluetooth is on the iPhone, it'll do that automatically, and it should be on already. When you're doing the data collection, make sure that the logo is oriented correctly. So it should look like an A and not like a V. That's kind of important just to make sure you're keeping track of. So once you get here, you're going to go ahead and place the index and middle finger from your patient's right hand on the right electrode, and their index and middle finger from their left hand on the left electrode. Just with light pressure. And as soon as the device senses fingers on the electrodes, it's going to start recording. So you're going to see a contact indicator with an activity spinner that says initializing, and then it's going to record for 30 seconds. So you have to make sure that the patient doesn't take their fingers off the electrode for those 30 seconds. If they accidentally take it off, it's going to stop the recording, then you have to start it over again. So just keep that in mind. And then after those 30 seconds, it's going to say the recording is complete and the patient can remove their fingers. You're going to get a pop-up here that says, did mobile record the EKG? The reason this comes up is a lot of times people will use the mobile EKG for personal reasons. So if the same person is doing the recording over and over again on their own data, It can kind of look at trends in that. But since we have different patients, we're just going to press no, it was a guest over here. And then the next thing you have to do, that's all the data collection you're going to be doing. So now you're just going to have to save it to the Dropbox. So in order to do that, you're going to scroll down, click on download PDF. You're going to see a pop-up over here that tells you to enter a password. You can just press skip. And then that's how the recording is going to look like. And then you're going to click on this little symbol in the upper right-hand corner. And then you're going to select Save to Dropbox. And then after you press Save to Dropbox, this little screen is going to pop up. And in that screen, in the Save To section, you're going to make sure MobileECG Study is selected. And that's the same folder that we opened in the very first step in the Dropbox. So just make sure MobileECG Study is selected. And in the To section, you're going to type in eacnresearch@gmail.com. And again, this should already be on the iPhone, but just in the off chance that it isn't, just make sure that that's what shows up, or make sure you select it if it's not there. And after that's done, you're pretty much good to go. You're going to press post, which is over here. And then afterwards, you're going to go back to the Dropbox app, and then you're going to change the file name to the correct code. So remember earlier, just NC001 was on the Dropbox. So after you do this new data collection, it would say NC001, and then the new file would pop up with a weird, just random file name. So you have to make sure you go to the Dropbox, you press these 3 dots under the file name, you press rename, and you just rename it to the proper collection code. So for this example, it's NC002. And then that's pretty much it. You're just going to repeat that process for all the patients that you see on your shift. And some things to keep in mind: make sure to clean the cardiomobile after every use. AJ or Rican, I think, is going to talk more about PPE that will be provided. So you guys will get wipes to wipe down the device. And then just remember that someone's going to be using the device after you. So make sure when you're done with your shift, you leave the device in the designated location in the office. And I'll be sending you all a picture probably tomorrow into the GroupMe of where that location is going to be in the office. So that location is where the phone, the cardiomobile device is going to be, as well as the informed consent and survey forms. So also make sure to charge the phones whenever they're not in use. We're using like iPhone 7s, so the battery life isn't the best. So just keep that in mind. Whenever the phone's not used, just make sure it's always charged in, because we're going to be using these phones a good amount throughout the week. But yeah, those are all the data collection instructions. Does anyone have any questions? No. And then you guys are going to have access to these study instructions. So these pictures should be pretty self-explanatory. And I think what we're planning on doing is the first week, when you guys are touring the nephrology clinic, you guys can also just mess around with the phones and the devices, just to make sure that you guys feel confident about data collection. So that pretty much covers it for the study instructions. And then there's a research calendar on the drive as well. Since the collection code is super simple, there's not much on the calendar. It just reminds you of the collection code format. So it's just going to be NC for nephrology clinic, and the patient number is going to ascend in chronological order. So it's going to start with NC001 for patient number 1, and then it's going to move up with every single patient. And then in the beginning of the semester, all of you all filled out a Google form with your availability. So I used that in order to create a device flow. Let me know if you'd rather switch to another shift, because there's 2 openings for every shift and some only have 1 person on it. So if your schedule changed for some reason, feel free to reach out and let me know. But how we have it set up is Monday through Friday. There's going to be 2 shifts per day. One is going to be 12 to 2:30, and one is going to be 2:30 to 5. So when you first come in for your shift, you're going to come to the Equal Access Clinic office. You're going to pick up all of the stuff. And then at the end of your shift, you're going to drop everything off to the office. And the nephrology clinic is really close to the office, so it works out perfectly. And then on the bottom, we just have some information about the location And then if you guys have any questions, feel free to message the group me or the Equal Access Clinic research email, or me, Rikin, Susanna, or AJ, any of us. And I'll probably be your main contact if you want to reach out individually, just because I'm in Gainesville. I'll be the most involved with like the groundwork and the in-person data collection. But yeah, does anyone have any questions on anything I talked about? No? All right, well then I'll stop sharing, and then I think Rikin is gonna go.
Can you guys hear me?
Yes.
All right. So I'm going to talk briefly about safety and PPE and all that stuff. Let me try sharing my screen here. All right. So again, this is the Research Assistant Drive. Right here, you have the absent question forms. So this is just, I know you guys' schedule varies, testing and all that can come up. We just ask, Kevin just showed you guys the calendar. We just ask that if you guys can let us know in advance, preferably 2 weeks in advance, if you are going to be missing a day. If you know right now, just letting us know. That way we can try shifting schedules. If you have like a friend working later in the week, maybe shifting with them. Because we're really trying to collect our data on a timely basis, make sure there's people on every shift. And we have a packed schedule. So this is just a study absent form. Feel free to fill it out. We'll get the information. And if you know somebody later in the week when you're free and they're willing to switch with you, that also will work. But just this is the absentee form for you guys to know. Now let me go back. All right. And then this is the question concerning, I know it's hard to reach us sometimes, and maybe you want to be anonymous with something you might see in the clinic or with like one of your peers or just with a patient. Anything that you guys can think of where you feel unsafe or you feel like something's not being done right, please fill this out and we'll address it either with ourselves, with Dr. Siegel, if it has to be taken to somebody else. We'll address it. And this can go to anything, peers, nursing staff, anything you can think of. If you want to just fill this out anonymously, it's available to you guys. So now PPE. You guys will be doing your tours this week with Michelle, who's the manager. Who's the manager at the clinic. She will tell you guys about the PPE. The main things, as Kevin pointed out, was the cardiac mobile device. There's going to be people using it. Make sure you clean it with the purple, I don't know if you guys have seen it. There's this purple container. It's just kind of like those Kleenex wipes. Use gloves, put gloves on because it can irritate your skin. Grab a piece, just clean off the iPhone, clean off the cardiac mobile every use. Because there's going to be patients using it as well. As for mask, I'm sure you all have masks. If not, the clinic has regular masks. As for N95s, that I'm not too sure if we'll be able to provide just because the hospital has a shortage. Even me as a med student, like it's very hard for me to get N95s. So if you ever in any situation feel like this patient, and they're screening patients for COVID, and then it's not like an actual nasal swab, it's more temperature. But if for any reason you feel uncomfortable seeing a patient, you absolutely do not have to interact or anything. Or your safety is like our priority here. So for PPE, masks will be provided if you don't have any, and then wiping down, Michelle or the nursing staff can show you exactly where you can find that. And if you have any questions about PPE, please feel free to ask me. I just ask people within the hospital. And I'll get back to you guys about the N95s. I have my doubts, but maybe I'll be able to scavenge some for you guys. That's about it. If AJ wants to wrap up.
Yeah, absolutely. So I think Susanna, Rika, and Kevin, they all did a really good job. Really the last thing on today's itinerary is that on the chat, I provided a link to a clinic tour timing availability form. So like Rikin was mentioning, Michelle is a clinic manager. She's been very kind to us, and she's been offering about 3 different days where she's willing to have these clinic tours where we feel like that's going to be really the best opportunity for you guys to prepare, because you're able to view the clinic, get a sense of where you belong, where you come in, and everything like that. And also during that same day, you'll have the opportunity to go to the EAC office, which most of you know where it's located. So you have an understanding about how far it is from the nephrology clinic, and use the devices there. After you pick up, read the consent physical version, see a physical version of the surveys and the like. So if you all could please go to the chat bar and visit that form and complete it with your availabilities. Our goal is to try to get groups together at a similar time, because ideally on each day we have a time that works for a small group, so that you all can go and it won't be as spread out. Of course, we understand, if you have a really full day of classes and maybe you're an outlier and you have to go at like a 3 p.m. that day, that's okay. But ideally, we just want to give Michelle the heads up so that she can be prepared when you guys attend. So I'm going to be just kind of tracking the responses and making sure you all are able to fill out the form with your times. And I'll give you a few minutes to do that, just because it would be best if we have that information now. Is everyone able to access that that form?
Did you say you sent it in the chat? Was it only there?
Yes, it's in the chat. If you scroll down, it's under the header clinic tour form.
Okay. I think I got disconnected at one point, so I don't see. Yeah, it must have been after you sent it. So if you could resend that.
No problem.
Thank you.
Okay, it's been resent.
Okay. Thank you. I see it.
Okay, perfect. Yeah. So please fill that out. Hopefully it won't take too much time. You guys probably have a good idea of your schedules. And once we get that information, we'll send out what times that you agreed upon and work with the group, just so that's easy on Michelle. Yeah, I mean, overall, I think we're really excited for this study. And as you're filling that out, I wanted to give you an update on the literature reviews. So today, Nikhil was supposed to attend our talk, but unfortunately, he had some, family issues. So I'm going to be reading his update from what he sent me. So he said, hey everyone, I hope you're doing well. He was able to write back feedback on the atrial fibrillation and low resource paper, but he was unable to get to the AI-based paper. And what he intends on doing is that he wants to finish the AI edits this coming week or so. And he would like those people who he has read and provided feedback on with regard to the atrial fibrillation paper and low resource paper to address the edits and suggestions that he had made, and not to resolve the comments. So on those forms you can press like check mark, it's done. He would like those comments just to stay, so it maintains a reference that we can look back on. And the next step is to please make sure that the APA format that we discussed for in-text citations, we can transition to AMA numbering later. This leads to an easier way to track citations. And finally, please be sure you're reading our GroupMe's so I can relay messages there in the future, and I want to make sure that you all can really finish this project strong. And I was reading over the literature reviews; they look very strong. I feel very confident in their ability to get published. Just it'll take some editing and some time, but with our study group, we have just really excellent people. And in addition to that, we have some great advisors. New to the study is a electrophysiologist at UF Health, and he'll also be helping us prepare those papers, as well as we get data for the study, we'll be able to consult him and get his information. So looking at the form, we have about 9 responses or so. Those of you who can fill this out right now, it would be great that you can do that, just so that it's out of the way. And as you guys are completing that, I guess I want to open the floor to questions and answers. You have, Rikin, Susanna, Kevin, and I here. If you have any questions regarding logistics, PPE, anything of your involvement, anything that's unclear, this is your opportunity to ask those questions. So, yeah, great. So I see one question from Peyton. So hi, Peyton, how are you doing? How are participants being recruited? So our approach to that is that during the times that you're assigned to be at the nephrology clinic, you will be working with the staff and everyone there, and together there will be an assessment on what patients are appropriate for the study. But given how this study is developed, it's really broad, and we're able to pretty much enroll any of the patients at the nephrology clinic. Okay, so one approach, it could be that you could talk to them while they're in the waiting room, approach them there, reference the script that we had sent, and have an understanding of what the appropriate approach would be, and ask them first if they're interested in the study. Once you hear yes or no on that, you can proceed with the informed consent first. And that informed consent just makes sure that we're covered so that this person can be officially enrolled. Next would be either the completion of the survey or collection of data using the MobileECG. I think perhaps the survey would make sense just to do first to get out of the way. And then your role with the survey is essentially go each question with them, or have them fill it out themselves. But ideally, if you can go each question with them, I think that would be better. And once that's complete, then you instruct them on how to put the 2 fingers firmly on the MobileECG, perhaps using a clipboard if there's not a surface there as the surface for them to do that. But essentially, the recruitment's broad, and your approach would just be the patients at the waiting room. And perhaps depending on what the clinic manager tells us as we keep doing the study, we can make adjustments to that. So if she prefers that patients already in the examination room would be ideal, then we will recruit them in the examination room. It's something that I think we'll learn more about as we're doing it, but essentially who to recruit is really any of the patients at that clinic. Peyton, does that answer your question, or is there anything I'm missing?
That was perfect. I just wasn't sure if there were scheduled appointments, but it looks like it's active recruiting during our sessions.
Absolutely. Okay, awesome. Thank you for the question. Yeah.
I have a quick concern. So I was looking at the schedule for the shifts, and I saw that I was at the 3 p.m. time, which I asked because but I saw it was for Wednesday. I think I asked for Thursday because on Wednesday I have a class from 3 to 3:50, and on the Thursday my classes end at 2:45. So I think the Thursday would be the time that I would be able to do, or potentially Tuesday. But yeah, Wednesday probably wouldn't be able to work for me. So if I could make that switch.
Hey, Chadwick. Yeah, that sounds good. I can go ahead and make that change right now from Wednesday 2:35 to Thursday 2:35, if that works with you.
Or yeah, at 3 p.m. Yeah, that'd be awesome.
Yeah. Okay.
Okay, and then also I have another concern, but can I speak to you guys in private about that after the meeting? Is that okay?
Yeah,
Okay, thank you.
thank you.
Yeah, I had a quick question.
Sure.
What is the attire?
Yeah, that's a great question. So the attire would be similar to what you would wear at the Equal Access Clinic. You know, you want to dress professionally. You're going to be talking with patients and within a hospital setting. So ideally, you're wearing you know, long pants of some sort and you know, some sort of button-up or polo tucked in. I think would be appropriate for guys, for girls. You know, a professional type of attire that you would wear at Equal Access Clinic, I think would be appropriate as well. So I think that's just the usually, you know, the kind of the expectation in terms of attire. So is that a good response, Elijah?
Yeah, it was. Thank you.
Okay, good question. Thanks. Do you, so is there any other questions or anything? Are you all familiar with the Equal Access Office code?
I've forgotten it. It's been a while.
Okay. Yeah, I was just thinking of that. So what we'll do is on the study instructions, we'll post that and just as a reference so that there's no issue. Because for those of you, it might have been some time since you've been to the Equal Access Office. There's just a rather 4-digit code that you need to plug in, and we're going to write that onto the study instructions. So you know that that's one place you can always go to get that information. And is there any other questions you guys have at the moment? Of course, you can always message us through our email or through GroupMe perhaps. Usually Kevin is a great point of contact if it's anything to do with data collection. And I see you already added the code to the study instructions. So he's really on top of this type of stuff, guys. If that's all the questions, then you know, I really appreciate everyone taking the time. It takes a little time to talk through everything, but I think this coming week, with your ability to visit the clinic, to go to the EAC office, to use the mobile ECGs, I think you're going to be very confident that in your ability to collect data. And I, you know, really think this is one of the more exciting studies you can be in part of, and without it being really, you know, too tedious to do. So thank you all for attending today. If there's no further questions, and you know, Kevin, Rikin, and Susanna and I will just be sticking around as you guys exit if you have any questions at the end, okay? So you guys are free to go, and thank you for your time.